Hi, I'm Elissa Redmiles, and I'm looking forward to speaking with you today about UX and adoption challenges for COVID-19 apps. So as most of us who are attending this know, there are many possible kinds of COVID-19 apps that have been proposed, but there are three main types that have primarily been implemented. The first is, of course, contact tracing, which is the subject of this symposium, specifically the Google Apple enabled contact tracing. There are also apps that are information-based. So these are things that might provide personalized broadcast information or information about coronavirus hotspots, as well as general broadcast apps that just provide information without personalization. And finally, there are apps that have been developed that are symptom checkers or provide home health support or sort of surveillance for people who are at risk or who have been diagnosed with COVID. But for today's presentation, I'm going to primarily focus on adoption and UX challenges for, of course, contact tracing apps. So adoption matters for all of these apps, but particularly for contact tracing apps. And this chart is from research that was conducted at Oxford, where they simulated how different levels of app adoption in a population might influence the number of new daily cases. And so what we can see is that the benefits of contact tracing app use scale quadratically with the number of users. And that's of course because it's not just a potentially infected user who needs the app, but also the people who have been exposed to them so that they can be notified. And this doesn't mean that low app adoption won't be useful, but just that we get more and more benefit as the apps are more adopted throughout the population. As a result, of course, we really care about adoption. And what we've seen from early sort of unofficial rough estimates that have been reported in the news or in app documentation is that we're seeing about 20 to 40% voluntary adoption. And so adoption is really something that we need to facilitate and encourage and understand, what are people's considerations when they're deciding whether to adopt, and how might we best be able to address those considerations in advertisements, in app implementations, as well as in sustained use of the app. And so to give a brief overview of the kind of trade-offs that users might be considering when they're deciding whether to enable a COVID-19 app, I'll summarize these briefly here. So people are thinking about what benefits the app may offer them. So these can be things like the app will be able to notify them if they've been exposed, but they can also be societal benefits. So things like by installing the app, I will be joining the fight against coronavirus, or by installing the app, I might be helping my government or researchers get better data on coronavirus to develop cures. So there are many possible kinds of benefits that people are going to be considering. We've also seen in various research that's been conducted so far that people are considering the provider of the app. Is it being provided by my public health department? Is it being provided by my federal government? Is it being provided by a university, my employer, my health insurer, etc.? And in different countries across the world, different populations have preferences for who they most trust or want to provide the app. And even within countries, research has shown that different people may be more or less comfortable with different providers depending on different attributes of them as a person and their trust status. Of course, early on in the development of these contact tracing apps, there was a lot of discussion about privacy concerns, and that's something that users are thinking about as well, and concerns about authoritarianism. So, these apps represent in some ways an increased level of surveillance, and how do people feel about that? When do they think it'll be rolled back? Are they comfortable installing an app given their own personal feelings about surveillance and authoritarianism? Um, there are also a number of considerations people may have around mobile costs. So if they don't have unlimited mobile data, or if they have an older device where this will cause a lot of battery drain, people have different sentiment around that. There's different attitudes in different countries that may have different data plan approaches, as well as for people with different socioeconomic status within a given country. There are also people who, by practice, don't use mobile phone applications, even if they do have unlimited data or a highly featured phone. And so that's something that needs to be addressed and considered when we think about these COVID-19 app solutions. A key component, of course, is accuracy and will the app work? So research that we've done at Microsoft Research, as well as research from Johns Hopkins, has shown that people do care about accuracy. And this is a consideration that they have in the back of their minds as they're making decisions about adoption. And finally, there's been in many different countries, different kind of fake or misleading news information about coronavirus. So people may not believe that it is a threat or be sort of overwhelmed by all of the content about COVID. And so they may not be interested in looking at things like apps because either they don't believe or they're overwhelmed. I've linked at the bottom a paper that describes how these trade-offs might align with different app architectures. And there's a number of different research projects that have tried to look at these types of trade-offs, which I'm happy to discuss in the breakout or in the Q&A. And each of these adoption considerations offers many implementation directions, right? So I mentioned benefits briefly. Apps could have many possible benefits, and many research projects have looked at these. The EU Toolbox has tried to summarize them. People can get personalized guidance. They can get information about hotspots, maybe not through the Google Apple protocol, but it's something they might desire. They can get exposure alerts. Apple recently added to their app the ability for people to donate data to researchers. That may be something that they're interested in, so on and so forth. So within each consideration, there's a really large number of possibilities and directions and things to think about in terms of what might most appeal to the users that you're targeting. Research from multiple groups has suggested that these considerations and even more that I won't have time to cover today do matter for adoption. So this is the result of some research from the University of Michigan and Microsoft Research, where they were able to look at, what components would make up someone's hypothetical decision to install a COVID app. And we see that there's importance from at least 5 attributes that were tested there. And other research, for example, from Hopkins has also shown other attributes being important. So there's definitely a number of things that are going into people's complex decisions around these apps, more so even than traditional, apps that aren't health related or aren't pandemic related. A final important point is that contact tracing apps are unique. And they're unique particularly in the fact that they benefit others more than they benefit the user. So the user can get exposure notification, but of course that's not necessarily going to protect them if they've already been exposed. Really, those exposure notifications are helping them protect the community by being able to isolate, by people being able to know to isolate so they don't infect more people. And this is pretty unusual, right? Usually when we're trying to get people to install something or do something, it's for their own health. It's not necessarily to benefit others. And so this makes them unique, as particularly in the app space. And one interesting direction that, for example, Johns Hopkins University has looked at is trying to add individual incentives to make a benefit for the user themselves, for example, by offering gift cards for people installing the apps. And they've found that could even be twice as powerful as all those other considerations I talked about. Granted, this was a small scale study, so I wouldn't go and generalize that everywhere, but it's important to think about more broadly, how might you encourage users to feel that there's a benefit to them directly, or how might you play up benefits to others? And that's something to think about, as well as all of those other considerations as you're sort of designing the app and designing the UX. So, I gave a brief overview of many possible trade-offs that affect people's adoption decisions. There are, of course, others, including incentives and many other things. And particularly, there may be factors that are culturally relevant that haven't been captured in some of the research that's been done. And so it's important as we're going to think about implementing these apps to really think carefully or even do some quick user research to figure out what is making people hesitant, what is making people want to install, what can I learn from your reviews so that you can address the most important considerations and really encourage that adoption. Thank you. I hope this brief overview was helpful, and happy to answer questions in the Slack or in the breakout session, and looking forward to a great discussion and hearing what everyone else has seen in terms of adoption considerations and challenges. Thank you.